Hello, my name is Brian Lewis, and I'm a trainer with the JTNS program in Public Works. Today we want to talk about bloodborne pathogens. So, as we always do at JTNS, I'm going to take this opportunity to ask you to pause the video, talk about any near misses or accidents you may have had, and what you can do to correct those. After you've finished your discussion, simply press play and we will continue with our presentation on bloodborne pathogens. Hope you had a fruitful discussion. We'll go ahead and get started talking about bloodborne pathogens and what we need to do. As I said before, I hope you have reviewed and discussed any near misses, close calls, accidents, and take as much time as you need. I hope you took as much time as you need. So when we talk about bloodborne pathogens, it's important to realize we're talking about microorganisms that can live in blood or other potentially infectious materials, or you might hear that called OPIM from time to time. Some examples are hepatitis, and some people may think of HIV when you hear this definition. If you're a child of the 80s like I am, typically you remember HIV and you remember the AIDS issue that went on in the 80s. So that gives you a little bit of history, just a little bit of history of how this standard came to be, right? How it came to be. So if you wanted to look it up in the OSHA standard, you'd go to 29 CFR 1910. 1030 and you would look at that, and as you look at it you would notice that it was published in December of 1991, and it was revised in April of 2001. And so the scope, which is important for all these standards, applies to everyone that's potential occupational exposure or has occupational exposure to blood or OPIM, other potentially infectious materials. So for the most part, what we're talking about is healthcare workers. However, it's important to realize that this standard just does not cover healthcare workers. Yes, when you think of OPIM, blood, exposure to blood, generally you're talking about doctors, surgeons, nurses, EMTs, paramedics, people who basically render or whose primary job is to render medical treatment, right? But it's not just health care workers who have exposure or potential exposures, right? And so there's a whole lot of people that have that. So you just think about what you would do in your own facility when you have some kind of incident or injury. Somebody falls, they cut a scalp, and as you probably know, any injury to your scalp or head causes a great deal of bleeding. So you have to assess the situation first, activate EMS if you need to, probably going to because it's a head injury. Get the first aid kit, and the very first thing you do, always, is put on your personal protective equipment. So what do we mean? We mean gloves. It's important that we put gloves on. It's important that we not touch anyone else's blood. It's important that we make the assumption that every person's blood, no matter how well you know them, is contaminated. It's important that we realize that if we have to end up picking up, something that's severed, a digit or a finger or a piece of skin or something along those lines, that's other potentially infectious material. We must assume it's contaminated. That assumption keeps you safe. That assumption keeps you safe. Just like every gun should be treated like a loaded gun, regardless of what you think. You treat every gun as if it's loaded. That's the first rule of gun safety. And the first rule of keeping yourself safe when it comes to bloodborne pathogens is you treat everyone's blood as if it's contaminated. You get the first aid kit, you put on your gloves, other PPE as necessary, administer first aid, and then you of course have to clean up and dispose of any materials, and you have to clean up any kind of surfaces that have been contaminated with blood or OPIM. So this is important that we take precautions whether you're rendering first aid or whether you're actually performing cleanup. So what we need to know: occupational exposure. Occupational exposure is any reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or OPIM that may result from the performance of an employee's duties. Taking care of an injured coworker, maybe you're being a concerned citizen and you're helping a bystander out in the world. Maybe you're involved in environmental services. Maybe you have exposure to waste or sewage. And there are many others that I probably can't even begin to think of, but some of you all do know. So it's important that we take this definition of occupational exposure serious, and not only that we take it serious, but we apply it. We apply it correctly, right? So the key components is an exposure determination. This is something that all employers need to do. It's part of their written bloodborne pathogens program. You list job classifications, and as you list those job classifications, you make a determination, an exposure determination. You decide who are people that are definitely going to have occupational exposure, who might have occupational exposure, and who definitely will not have occupational exposure. You have to do that, and you have to list them, and that tells you who needs training, who needs access to PPE, and it is fundamental first step going forward in protecting employees and workers from bloodborne pathogens and OPIM. You have to list the tasks and procedures that may occur in the course of a person's duty that would cause the exposure or not cause any exposure. So that's important. The exposure control plan is a written plan that's required by 1910.1030, the bloodborne pathogen standard. So you got to have, hey, how are we going to comply with this? Engineering controls, work practice controls, the use of personal protective equipment, how we are going to offer, when we are going to offer hepatitis B vaccination series, how we are going to conduct ourselves on post-exposure incidents, evaluation, and how we're going to follow this up. The communication of hazards to employees, which is primarily training, and of course what we're going to do as far as record keeping. The procedure for the evaluation of circumstances surrounding exposure incidents, immediately available for exposed employees to a confidential medical evaluation and follow-up. So what does this mean? Well, what we're talking about here is an exposure incident where you have blood on blood or blood in your eyes, nose, or mouth exposure. So you have an exposure incident. You need to go have a confidential consultation with a medical provider, and you need to take some material with you on the way. And some of that material is the exposure control plan. You might need to take a copy of the standard. You definitely need a documentation of the routes of exposure and how and when the exposure incident occurred. This is really important because when you speak to this medical professional, you're going to be talking a lot about risk and what your options are to mitigate those risks due to your exposure incident, right? So you might hear standard precautions, you might hear universal precautions. It started out, the terminology was universal precautions, but there's been movement of late to say standard precautions, and those are precautions. Those are either engineering, work practice, or PPE options that you're going to use to prevent contact with blood or OPIM. all body fluids shall be considered potentially infectious materials. So engineering and work practice controls, you need to have access to hand washing facilities. Now, I know a lot of people work out in the field. If you don't have access to hand washing facilities, an alcohol-based sanitizer, you want to use that after you remove your gloves. Also, as soon as you can, you want to wash your hands with warm water and soap, right? Any kind of sharps that are on site that are being used, you want to manage those. They go in a puncture resistant container. So if your training involves giving shots, then you need to know what to do with the needles. Now, most people that have first aid training, basic first aid training, what you've been trained to do is not give shots. That probably goes beyond just about all of our training, and we do not want to exceed our training, okay? But you might have other sharps. You might have pieces of equipment. You might have hand tools that are sharp, and those may have been contaminated in the incident that occurred. So those things we want to consider too, and we want to put those in a puncture resistant container. We do not want food and drink in the work area where you can have those mixed or mingled potentially with food and OPIM or blood. So we want to keep those things separate. Any procedures that involve blood handling, we want to take precautions there so that those things do not involve or end up involving an exposure incident. If you have to transport something, say someone cut a digit off or a finger off in an accident, you want to take that, and hopefully they can reattach that in the emergency room. This good surgeon can do that, but you want to be careful how you pick that up. It is OPIM. So there are procedures in first aid where you take care of those things so they hopefully can be reattached, but you do not want to expose yourself to another person's blood. So there again, puncture resistant containers. You also want to protect yourself by using gloves. You want to, if you have a mechanical device, use that to pick up the specimen and all that good stuff. As far as contaminated equipment, you want to decontaminate it before you put it back in use. Pretty straightforward stuff as any surface. So PPE must be used even with engineering and work practice controls. The employer needs to provide PPE. Mainly we're talking about gloves at different sizes because people have different size hands. You could also have face shields, mask, eye protection, mouthpieces if you're given emergency breaths, those types of things, because a lot of times in these incidents what happens is somebody takes a good lick to the face. They may be bleeding from their nose. They may have split lips, teeth knocked out. There's going to be blood involved. And before you give those emergency breaths, you want to make sure you have a barrier to protect yourself, right? We want to make sure that we keep the work site clean in a sanitary condition. We want to have a good procedure for cleaning and decontamination of items and safe disposal of any material that's contaminated. So what do we mean by decontaminating? Well, HIV, the virus that causes AIDS, does not live real well outside of the body. Hepatitis B, on the other hand, depending on who you listen to and the conditions, may live for a while outside of the body. So before you clean or wipe up any blood, you want to decontaminate it. So you can use 10% solution of bleach and water that's been mixed up fresh, and you put that on top of the blood and you let it sit there for 10 minutes. After 10 minutes, the bleach that's in that solution should have killed any kind of HIV or hepatitis B or any other bloodborne pathogen. Then it is safe to wipe up and clean up. If you do not do this, all you're doing is spreading whatever that potential pathogen is all over the surface. and depending on what it is, it may hang out there for a while, and somebody might catch hepatitis or some other bloodborne pathogen because it wasn't properly decontaminated. So we want to decontaminate surfaces, tools, those kinds of things. We want to do that correctly. Safe disposable of contaminated materials, they go into a red bag, a red puncture resistant container. It has a biohazard on it, and we want to make sure that we dispose of those correctly. Typically what that means is giving it to the ambulance personnel and let them taking it to a medical incinerator eventually and being disposed of correctly. Regulated waste, like I said, it goes into a red bag with a biohazard symbol on it, and you want to make sure it's closed, that it's constructed, it can contain all the contents. In other words, you don't want to overfill it. If outside contamination of the container occurs, it's got to be put into another container. Disposable of the waste shall be in accordance with all the regulations, federal, state, local, that sort of stuff. Like I said, typically emergency personnel will take that waste and dispose of it for you. Contaminated laundry is not something you typically think of in utility work. However, it does happen. It does happen in hospitals. So depending on emergency type situations, occasionally sharps can be found in laundry, especially in hospitals. If you are in a situation where emergency services people, EMTs, paramedics, others are administering medical care, they move fast, and their main objective is to preserve life. And so after they're finished and they're gone and they're transporting a patient to the hospital in an effort to preserve life, you must be careful. Contaminated laundry, contaminated anything could be left behind. It's unintentionally. So before you go over there and stick your nose, so to speak, into what has just happened, you want to pay attention, and you don't want to touch anything that's contaminated. You don't even want to pick up anything contaminated, even with a gloved hand. You want to use a mechanical device to pick it up, scoop it up, put it in a puncture-resistant container. So make sure that everything's labeled. Make sure that you protect yourself through engineering work practice controls as well as personal protective equipment. The hepatitis B vaccination, the employer is required to make that available and appropriate to anyone who has had occupational exposure. Post-exposure evaluation and follow-up to all employees who have had an exposure incident at no cost to the employer at a reasonable time. Needs to be a licensed physician or healthcare professional according to the recommendations of the U.S. Public Health Service. All lab tests conducted by accredited lab, and it shouldn't cost you anything as far as the employee goes. So for the post-exposure evaluation and follow-up, documentation of how you got exposed, how you got blood on blood contact or blood in your eyes, nose, or mouth. You want to identify and document the source individual if you can obtain their blood and have it tested. In a absolute best case scenario, that person's blood would show no bloodborne pathogen. Right? So they would test negative for hepatitis or HIV. That makes your decision for your treatment a lot easier. However, if you cannot obtain the source individual's blood, or for some reason you know that the source individual has some kind of bloodborne pathogen, you have to speak to that healthcare professional, that doctor, about any kind of prophylaxis and care. So what are we saying there? What we're saying is you need to discuss the potential drugs that you might need to take that would keep you from converting from a normal healthy person to contracting some kind of bloodborne pathogen. And so the healthcare professional would have a counseling session with you to tell you what the risk that you run by not having taken drugs or taking the drugs, the evaluation if you convert, and this is all confidential. Now, this is not a one time stop shop kind of deal. This thing can take 18 months or 24 months. A lot of people end up going back every 3 to 6 months to have their blood tested to see if they have converted to hepatitis or HIV. It's something that needs to be done, and it can wear on you mentally for sure. It absolutely can wear on you mentally. So we want to take this into consideration. Like I said, it all needs to be confidential and needs to be treated confidentially. So the communication of hazards to employees, well, this is really important. We need to have open, honest discussions. We need to have training at the time of the initial assignment. We need to have training annually. Anytime any changes occur, we need to let people know what the changes are. Besides this, we also need to make sure that we discuss in our training environments in a language that people can understand. So my primary language, the only language I speak, is English. So if you do not speak English, you need to find somebody that can interpret this information to you, or listen to someone who speaks your primary language so that you can understand what your rights are and what you can expect according to this standard. Information needs to be provided to all employees who are at risk at no cost, and 1910.1030 list all the training program requirements we try to cover, right? Medical records shall be maintained for the duration of employment plus 30 years. There again, those things need to be secured. They're not for being disseminated to the public or anyone. They need to be secured for employment plus 30 years. Training records must be maintained for at least a minimum of 3 years from the date of the training. That's important. Now, honestly, we have people with exposure incidents all the time that we shouldn't have. And why do we have that? Why are people not 100% compliant? Well, part of it is some employers just don't feel the need to do training. Other people are a little busy, a little hectic. You're rushing around, got things that are in their point of view more important. And modern life is hectic, right? So you got people rushing around, and they don't really think about things until accidents happen. A decreased awareness of the hazards. As I started out this presentation, I am a child of the 80s, and as a child of the 80s, I remember the 80s. I remember when HIV became a very common topic talked about in news, a very common topic talked about in society, and there was a great deal of awareness. There was a great deal of misinformation. Society has moved on from that. It's not quite as prevalent in our news broadcast and in our normal publications that we have, that we read out about on a daily basis. So we don't hear about HIV and other bloodborne pathogens as much as we hear other news. And then the other thing is, unfortunately, we all humans get comfortable with hazards. This is just part of the human experience. And sometimes we just feel the universe is looking out for us, and we accept the risk by telling ourselves, this cannot happen to me. So we just accept the risk by telling ourselves or having a belief that it cannot happen to me, that I'm special, and that causes us to take risks that we wouldn't normally take. And we need to be honest with ourselves, and we need to tell ourselves, yes, things can happen to us, and because of that, we need to be aware of it. So, in summary, we need to know the sources of exposure: blood, OPIM. We need to know our rights, protect ourselves under the regulations, know your company policy and procedures. Always wear your personal protective equipment. Always use engineering controls, work practices. Make sure you do those things. If you don't know, please ask. I so appreciate you all paying attention during this presentation. I hope all is well. I hope all continues to be well. If you need to ask any questions, it's important that you know that as part of the Bloodborne Pathogen Standard, you have the opportunity to ask questions. Please do not hesitate to contact your JTNS instructor. We will answer any question you have. We may know the answer right off the top of our head. We may not. If we don't know the answer right off the top of our head, we will research it and get back to you with an answer. That's really important. Thank you so much. Once again, everybody have a great day, a great month, and we'll see you next time when we have a JTNS training session. Bye.